Assalamu alaikum. My name is Hafiz Muhammad Shreeb. Hope you are doing well. Now we are discussing about hepatic disorder, acute and chronic liver disease. Table of content is jaundice, hepatitis, liver cirrhosis, liver failure. First of all, we are discussing about jaundice. What is jaundice? Jaundice is a yellow discoloration of the skin, sclera, and mucous membrane due to the excess plasma bilirubin. It is also called hyperbilirubinemia. Its normal value is 0.3 to 1.3 mg per deciliter. Between normal and 2 mg per deciliter is asymptomatic state. It is called latent jaundice. Bilirubin exists in two forms, conjugated bilirubin and unconjugated bilirubin. Conjugated bilirubin value is 0.1 to 0.3 mg per deciliter, and the second is unconjugated bilirubin normal value is 0.2 to 0.7 mg per deciliter. We are already discussed bilirubin exists in two forms, unconjugated and conjugated. What is unconjugated bilirubin? Unconjugated bilirubin is insoluble in water and it does not react with the reagent directly except after addition of the methyl alcohol. Thus, this is called indirect bilirubin. What is conjugated bilirubin? Conjugated bilirubin is water soluble. It reacts directly with the reagent. Thus, it is called direct bilirubin. Now you can see picture of the jaundice yellow discoloration of eye. Now see causes of the jaundice. First of all, first cause is acute inflammation of the liver, inflammation of the bile duct, and the next is obstruction of the bile duct, and the next is hemolytic anemia, and the next is liver cirrhosis, and the next is Gilbert syndrome. Now we are discussing about types of jaundice. There are three types of jaundice. First is prehepatic jaundice. It is also called hemolytic jaundice, and the second is hepatic jaundice, and the third is post-hepatic jaundice. Now we can see first type of jaundice, prehepatic jaundice. Prehepatic jaundice is increased production of the bilirubin due to excess breakdown of the hemoglobin, and it is indirect bilirubin, insoluble in water since unconjugated, and the prehepatic value is 0.3 to 1.0 mg per deciliter. And the second type is hepatic jaundice. It is also called hepatocellular jaundice. It is due to the disease of the liver parenchyma and the increased level of the conjugated and unconjugated bilirubin present. Hepatic jaundice value is 0.3 to 20 mg per deciliter. And the third type is post-hepatic jaundice or obstructive jaundice. It's a result from the obstruction of the common bile duct, and the post-hepatic jaundice value is 0.6 to 45 mg per deciliter. What is infant jaundice? There is also infant jaundice which usually occurs in preterm babies. Infant jaundice occurs due to the fact that the baby liver is not mature enough to quickly remove the bilirubin from the system, causing an excess of bilirubin. Now we are discussing about the hepatitis. What is hepatitis? Hepatitis is a broad term that means inflammation of the liver. It is most commonly caused by viruses, but also be caused by the drugs, alcohol, chemicals, autoimmune abnormalities, disease, and metabolic abnormalities. Hepatitis A is always an acute short-term disease, while hepatitis B, C, and D are most likely to become ongoing and chronic. Hepatitis E is usually acute but can be particularly dangerous in pregnant women. Now we are discussing about the types of the hepatitis. There are 5 types of the hepatitis have been identified. hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. First of all, we are discussing hepatitis A. Hepatitis A is highly contagious liver infection caused by the hepatitis A virus HAV. Hepatitis A virus is ribonucleic acid RNA virus of the enterovirus family. It can cause acute hepatitis with jaundice, also cause acute liver failure. It does not cause long-term infection. Its incubation period is 3 to 5 weeks with the average of 28 days. Now we are seeing mode of transmission. It is transmitted primarily through the fecal oral route. The source of infection is crowded condition, poor personal hygiene, poor sanitation, contaminated food and water, shellfish, infected food handlers. Sign and symptoms we are seeing in the patient is fatigue, fever, abdominal pain, nausea, jaundice, weight loss, itching, sharp pain in the right upper quadrant of the abdomen, right hypochondriac, and the anorexia, loss of the appetite. Diagnosis we can diagnose through blood test, two kinds of antibodies to the virus, IgM antibodies and the IgG antibodies. IgM antibodies show acute infection and the IgG antibodies show previous infection or immunization. And the second type of hepatitis is hepatitis B. Hepatitis B virus can cause acute and chronic infection. Acute hepatitis B infection may last up to 6 months with or without symptom. Chronic hepatitis B is defined as persistence of the hepatitis B virus antigen for 6 months or more after acute infection with hepatitis B virus. Hepatitis B virus incubation period is 2 to 5 months. Hepatitis B virus is a complex structure with distinct antigens HBsAg, hepatitis B core antigen, HBsAg, hepatitis B surface antigen, HBeAg, and independent protein circulating in the blood. Mode of transmission of hepatitis B is mainly sexual contact, recognized as sexual transmitted disease. It is much more infectious than the HIV. Further mode of transmission are parental or permucosal exposure to blood or blood products, perinatal transmission. Source of the infection are contaminated needles, syringes, blood products, homosexual men, tattoos or body piercing with contaminated needles. Sign and symptoms we are seeing in the patient is abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea, vomiting, fatigue, and jaundice. Diagnosis we can diagnose through the blood test and serological test, liver ultrasound, and liver biopsy and fibro test. Third type of hepatitis is hepatitis C. Hepatitis C virus is an RNA virus and its incubation period is 14 to 180 days, average 56. It is found in IG drugs users and renal dialysis patients, and chronic hepatitis C infection results in liver cirrhosis. There is no vaccine for the hepatitis C. Mode of transmission of hepatitis C is transmitted through the blood, blood products, unprotected sex, contaminated or unsterile needles. Diagnosis we can diagnose through the hepatitis C antibodies and the HCV genotyping. Fourth type of hepatitis is hepatitis D. Hepatitis D is also called delta hepatitis. HDV is defective single stranded RNA virus that cannot survive on its own. It requires hepatitis B to replicate. Its incubation period is 2 to 26 weeks. Source of infection are same as hepatitis B virus. Hepatitis D virus infection is only possible if a person is already infected with the hepatitis B, or a person can be infected with the both viruses at the same time. We can diagnose through the hepatitis D virus antigen. Fifth type is hepatitis E. It's a dangerous type. Hepatitis E virus is an RNA virus and its incubation period is 15 to 64 days. More common in adults and severe in pregnant women. Source of the infection is contaminated water, poor sanitation, found in the Asia, Africa and Mexico. Hepatitis E usually resolve on its own within 4 to 6 weeks. Treatment focuses on supportive care, rehydration and rest. We can diagnose through the antigen HEV, IgM, IgG, HEV RNA quantification. And the third disease is liver cirrhosis. Liver cirrhosis is a chronic progressive disease of the liver, characterized by the extensive degeneration and the destruction of the liver parenchymal cells. Liver cirrhosis is a chronic degenerative disease in which normal liver cells are damaged and are then replaced by the scar tissue. You can see the picture of the liver cirrhosis, liver scarring. You can see formation of the nodular. Complications in the patient is ascites, hepatic encephalopathy, esophageal varices, Budd-Chiari syndrome, occlusion of the hepatic vein, Wilson disease, hemochromatosis, iron overload, cystic fibrosis, and at the end biliary atresia. And the types of the liver cirrhosis is alcoholic cirrhosis and the post-necrotic cirrhosis, and the third is biliary cirrhosis. First of all, we are discussing about the alcoholic cirrhosis, micronodular, portal cirrhosis and renal cirrhosis. Most common type of the liver cirrhosis caused by the chronic alcoholism. Men are more likely to have alcoholic cirrhosis. Fibrosis occurs mainly around central veins and portal areas. Small nodules form as a result of some offending agents. And the second type is post-necrotic cirrhosis. Post-necrotic cirrhosis is macronodular. You can already see in the picture of the formation of the nodular. Post-necrotic cirrhosis is a toxin-induced cirrhosis, broad bands of the scar tissues caused by the post-acute viral infection, hepatitis B and hepatitis C, post-intoxication with the industrial chemicals, more common in the women. And the third type of liver cirrhosis is biliary cirrhosis. Biliary cirrhosis is resulted from the chronic biliary obstruction and the infection, least common type, and scarring around the bile ducts and the lobes of the liver. Fourth and last disease is liver failure. What is liver failure? Liver failure occurs when there is insufficient metabolic and synthetic function for the needs of the patient. It can be divided into two types, acute and chronic. What is acute type? Acute liver failure is a rare condition and characterized by the abrupt onset of the severe liver injury. Acute liver failure is a loss of liver function that occurs rapidly in days or weeks, usually in a person who has no pre-existing liver disease. It's a medical emergency that requires hospitalization. Etiology of the acute liver failure. First is viral hepatitis, and the next is drug-induced hepatotoxicity related hepatotoxicity, vascular causes, and at the end metabolic causes. Diagnostic evaluation. We can check the physical examination and CBC test, prothrombin time, SGOT level, SGPT level, serum bilirubin level, serum ammonia level, and check the serum creatinine level, and electroencephalography EEG, and intracranial pressure monitoring, and the percutaneous or transjugular liver biopsy. Thank you.